So I'm very excited to introduce Dr. Heather Evans. She's an assistant professor in surgery at UW School of Medicine and director of surgical infectious disease at Harborview Medical Center. She's a general surgeon, and she specializes in trauma surgery, critical care, and endocrinological surgery. Her research focus is in the application of information technology to facilitate prevention, early diagnosis and treatment of healthcare-associated infections, including surgical infections. She has assembled a multidisciplinary team at the UW that's creating an MPower, the Mobile Post-Operative Wound Evaluator, a mobile app for patients to use after surgery to monitor their surgical wounds for signs and symptoms of surgical site infection and to communicate their findings to their providers. That's actually very cool. I'm just an obstetrician, and I basically just do, C-section, so I only have one wound, really, that I care about. But it really is nice. You're breastfeeding and you're at home and you've got a C-section and you don't know whether this is an issue, and you don't want to lug everybody back into the labor and delivery to get your wound checked. So this is actually great. My patients would love it. She's one of about 8,000 people nationwide who's been honored and selected by Google as explorers. So these are experimenting with the use of Google Glass, which is an eyeglass-like internet-connected device that is expected to be available for sale next year, guys. And she was among 4 scholars selected for the UW K-12 Mentored Career Development Program in comparative effectiveness in research. This is actually really a big deal to be selected for this honor. It's very competitive, and it is my hope that at least one of you guys in this audience, having finished mini medical school, that you should be selected next year, okay? You have the knowledge to do all of these things. She earned her medical degree from the University of Rochester School of Medicine and Dentistry, completed general surgery residence at University of Virginia, and where she also earned her master's in science of health evaluation scientist. She completed a fellowship in surgical critical care at UW. This is her family in the center. Concert photos depict the Monte Carlos, a band of health services researchers. And you as the backup singer. So are you going to sing your presentation tonight? Okay. On the main stage of the House of Blues in New Orleans, and we were the entertainment for ISPOR, which is the International Society for Pharmacoeconomics and Outcomes Research in New Orleans. Without any more introduction, here's Dr. Heather Evans.
Well, it's really an honor to be asked to speak today, and the last year has been kind of a whirlwind. I'm going to talk to you today about Google Glass, a new way of seeing medicine is the title of my talk. I've been doing talks like this, but not this complete, because even in the last week, we have been doing some pretty exciting things, and I'm very happy to share them with you tonight. So we're going to start off by talking about how the talk and the presentation is going to be structured. I want to give you an idea of what's in store in the next 30 minutes. I'm going to do a presentation, just sort of standard slides, with some video and some interesting things that we've been working on. But I'm also going to do a demonstration of Google Glass, because I think everyone here is really curious to know how it will work. I would like to take a moment to thank the audio-visual guys who helped me set this up today. They have exceeded my expectations as to what I'm going to be able to do for you tonight. I'm actually going to be able to let you hear what I hear as well as see what I see right here at my eye. So I think that's pretty exciting. Haven't been able to do that in another presentation yet, so thanks a lot to you. And then finally, we're going to attempt to do a live hangout with Glass. And because of that, I'm very interested to know if there's anybody in the audience who would be interested in trying to use Google Glass tonight. Does anybody want to volunteer? I'm serious. We're going to get you involved, okay? So Dr. Andy Wright is standing in the back of the hall. So Andy, could you come down here and pick somebody who's raising their hand? Okay, terrific. So Andy is going to take, sir, what's your name? Ron is going to go in the back with Andy in just a couple minutes, and he's going to learn how to use Google Glass. He's going to get the crash course, and we're going to involve Ron in the Hangout at the end of my presentation, so you'll get to see Ron again. So thank you very much, Ron. Thanks for your volunteering. So enough of the preamble. I'm going to tell you about Google Glass now. What is it? It's an augmented reality wearable computer. You may have heard of this term wearables. There are now 127 wearables that are now available on the market. They range from something sophisticated like Google Glass that integrates with the whole Google ecosystem to more simple devices that you can wear and give you feedback, such as the Fitbit, for example, or even you could call your smartphone a wearable in some cases. What's unique about Glass is not its hands-free access to the internet, but how it's really a part of the whole Google ecosystem. It also has a camera that's here, right in the front, and it's a 5-megapixel digital still camera and a 720p video camera. It has a Wi-Fi antenna, a Bluetooth antenna, and 16 gigabytes of flash storage. This is a little anatomic diagram. Since we're at the mini medical school, I thought I'd make a little anatomy diagram for you. And you can see all the different parts of the device. If you look at it as I'm wearing it, the battery sits back here, and it's a little bit heavier than the other side of the device, but it's surprisingly well balanced as you're wearing it. The battery also is next to the CPU. This is a touchpad in the front. I can control the device by using my finger to tap or swipe, go up and down. It's made of titanium and plastic, and it's actually relatively lightweight and really sort of agile. It's one of the more sleek and comfortable wearable devices that I've seen. I didn't mention that it also has a bone conduction speaker. I personally don't think that this works terribly well, and so it also comes with an earbud. Tonight we have modified the device slightly so that you'll be able to hear what I hear. We've attached a microphone actually to the speaker that comes off of the little earbud. So this looks a little bit different from the way that it would look if I were wearing it day to day. The device also has an accelerometer in it and a gyroscope and light and proximity sensors. So it has a lot of capabilities that really are just beginning to be unlocked. I want to remind all of you that this is in beta right now. We're beta testing this, we're exploring how it's being used, we're exploring applications. It's not really quite ready for prime time yet, but it's getting pretty close. So how did I get this device? I mentioned that I got it from Google. I'll say right now, this is my disclosure. I am not paid by Google. I do not work for them. In fact, I paid them to get the device. I was just one of the lucky people that was able to win the initial contest called If I Had Glass. Google has done an amazing job marketing this device. Everybody seems to want it. Everybody seems to want to know a little bit more about it because their limited release has been really tantalizing. What they did was they announced that they were having a contest, and you could either apply through Google+, and I certainly had never used my Google+ account by the time I heard about this in February last year. So I just did a tweet. So in 140 characters, I was able to submit my application, which was, if I had Glass, I would capture more events like this to learn how we could better take care of patients. And I'm not going to show you this video because it's quite long, but in a nutshell, this is a video that was captured by a BBC film crew that was following around an air flight medical crew who landed at their dispatcher station and found that he was having a heart attack. They stopped everything and they started CPR. They shocked him once and they brought him out of his life-threatening, almost fatal arrhythmia, and he was back to work in 2 weeks. So what was interesting about this to me was that this is a very relatively rare event. It's something that happens not too infrequently to first responders and pre-hospital providers, but we don't walk around with a BBC film crew following us every day. So this certainly was a chance happening. But with Glass, this lightweight device, we really have the opportunity to capture these really infrequent events and learn how we can take better care of patients by looking at what we did right and what we did wrong. And amazingly, a month after I put my application in, I got this tweet saying you're invited to join our Glass Explorers program. Woohoo! So, ever since then, I have been exploring. And I didn't intend for my last year to look like it did, but it certainly has been an amazing year. I'm going to talk about 3 areas where I think Google Glass has some immediate and future effects, some applications that I think you'll find interesting. And I'm going to show you some real video that we've captured using Google Glass in a variety of settings, mostly in the operative and procedural settings, because obviously I'm a surgeon, that's what I care about. And just like Dr. Mulligan said, you should be doing research in what is immediately available to you and what you have expertise in. So that's where I am. So the first domain is in documentation and audit. Now please don't fall asleep. I know documentation is the last thing that we're very interested in, but this actually makes documentation really exciting. Right now, in the operating room, when we do a procedure, when do we do our documentation? Afterwards. Does that make any sense? No, we should be doing it while we're doing it. We should have a really accurate record of what happens in the operating room. So this was the first thought that I had when I received the device. I thought, well, this is easy. I'll just take it to the operating room. And instead of doing my op note at the end, wouldn't it be great if I could capture these brief moments of key things that happened during the procedure?
2 fascial sutures. After placing the mesh on the inside, one of these fascial sutures went through the mesh as well. All right, go ahead and tie that.
And you can see I'm actually looking across the table at my residents' hands as they're tying these stitches in the fascia as we're finishing this laparoscopic hernia case. So that's one idea. Another idea is that doing the same thing, capturing that information in the operating room, could be used by the surgeon themselves afterwards to remember their case, to log these cases, and to go back and look in the past and see, oh, I remember I did this case on Mr. So-and-so, and this is how we did it. Maybe either for their own performance or as a document of cases that they have done and be able to log. And this is captured by one of our chief residents in neurosurgery. This is actually a burr hole being drilled in someone's skull to relieve a subdural hematoma. I'd actually never even seen a burr hole done before I saw this video a couple weeks ago. So it's not just for that surgeon, it's for me too. I've now seen something that I've never seen before, and I bet most of you have never seen a burr hole drilled either. I like to delve into this a little bit more, this idea of personal performance review. I want you to pay attention to Mike as he's doing this operation. What he's doing is he's going to get access to the femoral artery so that he can do a neuroangiographic procedure. So this is something that neurosurgeons do. I know, it's, wow, they use blood vessels too. Wow, there are a lot of different things that the neurosurgeons do. They're in the angio suite. Something else that maybe you didn't know. But I want you to watch, see how he's moving his hands around and he's checking to make sure that everything is in exactly the right place, same way every time. So he can go back and look at this video later and say, okay, I'm feeling for the artery here. I'm going to put the needle right between my fingers as I'm feeling the pulse. And he gets it on the first try. So this is an excellent demonstration of a high degree of competency in a pretty simple procedure, something that we do very commonly. This is not just done by neurosurgeons, it's done by angiographers, vascular surgeons, and other people who do these procedures can look to this as a standard. And we might in the future be using these brief video clips to document our competency so that we can get board certification. We don't do this right now, we submit our case logs, but what if our logs were actually video logs? This is something from the University of Washington operating room. It's the scope surgical checklist. We use it for every single procedure that we do in this hospital. We use a very similar checklist at Harborview. A similar checklist is used in pretty much all of the hospitals in the state of Washington. In fact, this is something that hangs on the wall in the operating room. It's a huge poster. It's almost life-size, and it gets longer every year as we add things that we believe we need to be doing every single time. Now, I'm not going to get into the content of the checklist, but I think that you understand that this is very much akin to the pilot's checklist before he takes off in an airplane. But what if we could take that checklist that's on the wall, that static checklist, and we could bring it to the surgeon's eye? The surgeon's the one that leads the checklist every single time. Who records the fact that we're going through this poster every time? Well, the circulating nurse in the operating room clicks on a number of things on the computer in the electronic medical record, but it's very much separated from the actual process of doing the checklist. One of my colleagues that is in the Cpr Glass Explorers, who is a developer, is actually sitting in the audience tonight. And Tim Clemens was the one that came up with this idea that we could bring the surgical checklist right here. And I'm going to show you the video of what it looks like. So this is essentially what you see when you're wearing glass. You go through a series of menus. You control this with a hands-free controls. And as we go through, as each item is completed, we give a wink, and it moves to the next item. So with every item being completed, we wink, and it moves to the next item. No hands. Everyone is able to have their full attention on the items in the checklist. Now, obviously, a little bit of this is contrived because I'm playing a video for you, but this actually does work. We tested it out the other day. Training. I think this is a tremendous opportunity for us. I mentioned tonight that I had not seen a burr hole being done before, so that was a new experience for me. Can you imagine what it would be like to be a provider and to not know how to do something and be expected to reach that level of standard of care? We actually, at Harborview, receive a lot of patients that are injured from a very disparate region. We cover 4 states: Washington, Alaska, Montana, and Idaho. We're the only level 1 trauma center for that entire WWAMI region. We receive patients that are critically ill very commonly. And one of the things that we try to do is we try to make their transport as safe as possible. One of the things that we do at Harborview very commonly is we will immobilize patients who have a pelvic fracture to keep the pelvis from having ongoing hemorrhage. This is a procedure that we do all the time, but the outlying hospitals that we work with don't know how to do this. I found this out when I was giving a talk in Montana about 3 months ago, and they asked us if we would be able to share this kind of teaching with them, and I said, well, I have Google Glass. We could probably make a video. And so Tim and I worked together this week, and we went to the emergency room, and we grabbed a bunch of people, and we demonstrated how to do this. Now, this isn't really that exciting, right? This is not blood and guts and gore and big incisions. This is just a sheet being wrapped around somebody's pelvis, but this is a life-saving maneuver. And the outlying hospitals didn't know how to do this. And so here we are trying to share what we know so that we can have a standard operating procedure across hospitals, and we can all do it the same way every time. We're going to be putting this video up this week on our Trauma Pearls website for our own internal teaching. And we're also going to be making it available to all those outlying hospitals that I mentioned. So this is an example of how we're using this very lightweight first-person video. This took an hour to do. It was absolutely easy. We did not hire a production company. We did not have a camera come in. We used all of our own equipment, and we were able to do this. And I thank all the people that were involved in making the video. I think while that's pretty exciting for us to be able to push our knowledge out to others, What I'm really looking forward to is the day when I'm in the operating room and I don't know what to do next. And instead of calling my partner at home and having to wait with my finger on something that's bleeding for some help, I'm going to be able to have their eyes on the situation right away. This is a video that I made with one of our surgical residents, another surgical resident who was interested in Google Glass. And what we've done is we've established that it is possible to do real-time coaching through a Google Hangout. A Hangout is kind of like Skype or FaceTime. It's a video conference. But what's different about this Hangout from others is that Andy, who is the resident who's doing the procedure here, was wearing Google Glass. And so what you're going to see is exactly what Andy saw while he was doing the procedure. And you'll hear him call me, and we're going to have a conversation while he's doing it.
Hi, Dr. Evans. It's Andy Mesher.
Oh, hi, Andy. What's going on?
I was hoping that you could help me out. We're about to get started with the central line. I know you know that I've done a number of these before, but I could use some help with the ultrasound.
Oh, sure, I'd be happy to watch you do this.
So what he's asked me to do is just watch him because he's done a lot of these before, but he wants to make sure that he's using the ultrasound machine just the right way to be able to locate the vessel. And so you can see, I've turned the sound down so you can hear me instead of him right now, but he's using that probe to locate the vessels in the neck so that he can safely puncture just the right vessel and be able to put the catheter in without any complication. And you can see, as he's looking down and he's using the ultrasound machine, you're seeing the ultrasound image just like he is. So he's transmitting an image through another image device, and it still works. What's really remarkable about this is that we're doing this in real time. He's asking for help. I'm giving him teaching and tips to be able to get through the procedure. And we were really excited to see that the image quality was this good. Now, this is just a simulator. We didn't try this in a patient. We're not really convinced that we're quite ready for real time, now prime time, but we're very close. And because we're still trying to convince ourselves that the fidelity is good enough and we're going to be able to have metrics that make sense, we've actually applied to the Institutional Review Board here at the University of Washington, and we're going to do another simulation study. All of the medical students and residents that go through our programs have to learn how to place a central line. It's a very important procedure for us. And what we're going to do is we're going to compare the kind of feedback that we can give those learners when we're standing right next to them, right behind their right shoulder as they do the procedure, using a standard checklist. And we're going to compare the kind of feedback that they're going to be able to get if we're just watching the video, if we're just watching that hangout. And if we are able to do the same level of feedback, then we feel like maybe we can move forward with this. There are others that are doing this work. And one of them is Dr. Martin Olson in East Tennessee State University. And I think that this is really the most exciting stuff that I've seen, because what he's done is he's taken glass and he's put them on the face of the patient. Now, this patient obviously is a simulator. But what a wonderful opportunity to learn how you're interacting with the patient in a crisis situation. What he's done is he has set up this environment where his OBGYN residents can go through a mock code. And I'm going to show you a brief bit of video from the eyes of his simulator.
Didn't you have a really fast labor last time, Noel?
So
like
you can
half an hour
see
or
the
something?
residents are interacting with the simulator.
Feels like you're actually progressed pretty far along. Okay, I'm just gonna lean you back, okay?
And they're talking to her and telling her, I'm going to change the level of the bed, I'm going to put you back.
Oh, good.
You
Okay,
can
are you
hear it's
doing all
pretty
right?
realistic. There's somebody that's acting out as the
complications?
simulator, giving the voice of the patient.
Okay. She's getting close.
But then Dr. Olson does something really brilliant. I'm going to skip ahead to the very end of this video. And I don't know if I'm going to be able to show it to you, but what he does at the end is he takes the glass off the mannequin, off the simulator, and he puts them back on himself. And during the time in which he gives them feedback, he actually wears glass and records the feedback session at the end.
That means you got it.
So here they
Next time
are
we have to do
sitting and getting feedback about how they did. They're watching the video of themselves performing this code situation, and they're laughing and enjoying that sort of embarrassing feeling when you realize that you've done something wrong. But this is really where the learning happens. So it's very exciting how he's using Google Glass. A couple more things. This is another area where I think Glass is really going to shine, and that's in the area of decision support. Can you imagine a time when you're never going to be alone again? You're going to be able to have that support that you need. In November, Dr. Wright, who's standing in the back of the room, is going to participate in the Hangout in just a bit. He and I did something that had never been done before. I was asked to speak at a conference in New York City about Google Glass and application in medicine. And I asked him if he was game to try and do a live hangout from the operating room to the conference. And so this is a picture of Andy in the operating room with his resident standing across from him. You can see he's wearing his Google Glass right here. And indeed, we were able to make it work, although our timing was a little off. We got to started the hangout right at the end of the operation. But he was able to transmit his images, and you can see them up on the big screen right behind me where I'm standing up at the podium. And we were able to have a conversation at the end of this operation to show that it was possible to be able to have this real-time communication. Now, it wasn't perfect. We did have some technical glitches, but we were successful in this proof of concept that we would be able to do this. Since that time, there have been others that have taken it a lot farther. This video was just published last week in Providence Journal. There's a group of emergency medicine physicians in Providence that are now using Glass in the emergency department in a test setting. And what they're doing is they're going to be able to transmit images directly from the emergency department as they're looking at a patient to a consultant off-site. So the consultant no longer absolutely has to be in front of the patient to be able to render an opinion. I'll show you a little bit later on here.
Allow us to look and talk to the patients directly and still allow technology to be part of that experience. The images flow through this camera and microphone, and they can be right at another physician's tablet or desktop computer. You know, our colleagues who are doing consults for us can be at home in the middle of the night and still be as if they were right at the bedside.
So this is the future. This is also the future. There's a developer named Chris Vukin who has been working with several other Glass explorers to develop something called Cpr Glass. And they've combined the ability to locate the nearest AED, to dial 911, and to keep the provider who is administering CPR on track to give chest compressions at the correct rate and the correct depth during CPR. We envision that this is something that a layperson would really value, because if they are never in this situation before, and performing CPR out in the wild is something that does not happen all that often, and it's certainly something that you want to be prepared for. The way they envision that this would work is that you would start the app, and it would actually provide decision support to the person who is going to administer CPR. And one of the ways it would do that is to show you either with a red or green circle, depending upon whether or not you are doing the appropriate number of compressions per minute, while also playing the song Stayin' Alive, because it actually is 100 beats per minute. So this is also not yet ready for prime time, but we're very excited about our development of Empower, which is our app that surgical patients will take home from the hospital on their smartphone to monitor their own surgical wound. We imagine that this is not for everyone, but I wanted to include a photo in my presentation. I didn't manage to put it in. I recently was rounding in the ICU here at the University of Washington, and one of my patients had 2 power strips, a laptop, an MP3 player, a smartphone, a tablet, and some other electronic device, all plugged in at the bedside while she was in the ICU. And this was not a young person. This was somebody who clearly was very wedded to her technology and was not going to let her stay in the ICU separate her from that. I think that we're going to have more and more patients like this. And in fact, I didn't include this also in my talk, but the Pew Research Foundation has shown that the highest growth rate in smartphone usage is in the lower income patient population. So I think that really we're not going to be excluding a lot of people if we make these smartphone apps, or potentially if we're going to be using Google Glass in the future. And as Google Glass rolls out this year, it would not surprise me if I start to see patients coming into my clinic wearing Google Glass and asking to record their patient encounter. So I think that our comfort with all of these apps and devices is going to have to rise, because we're going to have to rise to meet this challenge. We're going to have to rise to meet this opportunity. It's really going to change the way that we interact with each other. And I think it's going to enhance our interaction as providers and patients rather than get in the way. So I just want to take a moment to thank all these people that have helped me along the way. I'm not going to read this slide, but this will be available after the talk. And if you all want to contact me, this is how you'll contact me. But it's time for me to do a bit of a demo here. So I'm going to warn you that there's a bit of a lag time between the time that I activate the device and I control it and what you can see on the screen, but I'm going to do my best to try and fill in that gap. So I'm going to tell you that the way we operate the device is usually with the voice, and I'm going to wake it up by saying, "Okay, Glass." Google. Who won the Super Bowl?
Seattle Seahawks won Super Bowl.
I'm going to do a couple more things here. What most people do to start off with the demo is to take a picture. And there are two ways to do that. Well, three ways. You can squeeze the little button on the side here. So that takes a picture. I can also wink. Hopefully. There we go. And I can also control it with the menu. Okay, Glass, take a picture. Now, I spent all that time showing you how to do that because a hands-free operation is really critical in the operating room. But hands-free operation is really critical in other places too, like in your car. You can answer a phone call. You can send a message. You can, okay, Glass, get directions to the Space Needle. Now, what's really amazing is that when the map comes up, you'll see that I can turn my body and the compass changes. So the orientation changes depending upon which direction I'm looking. There are walking directions, there are bicycle directions, there are transit directions. It's really an amazing device. So it's harnessing all of this Google Now and Google Maps, but there are some other things that are really quite interesting. So I'm going to stop this. And I'm going to show you something else. Okay, Glass. Google. How do you say, "Where's the operating room" in Japanese?
手術室はどこにありますか?
How about this? Okay, Glass, translate. So that was Spanish to English, or English to Spanish. But I'm sure you can imagine that there would be opportunities to use this in the operating room even now, even without apps that are developed for surgery. Okay, Glass, Google, images of liver segments. So let's say you forgot where the anatomy was for the liver, and you wanted to look at the liver segments. You laugh, but this is like one of the most difficult things to memorize in spatial. It's 3D in orientation, and to really be able to figure out how it fits in the body, this would be incredibly helpful to a naive learner. Okay, well, I think I've shown you a lot of things that Google can do here, and with Glass. Let me just show you something. I mentioned the CPR app. There's another way that you can get information now, and that's just through Google. You can say, okay, Glass, Google, CPR instructions. So in the absence of being able to use an app, here's a website from the University of Washington that shows you how to do CPR. So really things are available that have never been available for us in a hands-free way, right at your eye, that's not distracting and doesn't impede your vision. It's a very exciting technology, and I'm very happy to show it to you tonight. I would like to still do the Hangout. I know that we need to stop because of the taping, but if we could just show briefly how to do that. Let me just show you. See if I can get it to start. So I'm actually calling them from my laptop. And Elizabeth is out in the hallway. And she's going to show.
Okay, Heather, we're going to need you to send it through again.
Okay. 1.
So this is the problem with Google. This is definitely a pager technology.
Liz, you're such a good sport.
I'm seeing them. Here's my crew.
Hi. Thank you so much for listening tonight.